Deep in the water, where the fish hang out, lives a glum, gloomy swimmer with an ever-present pout. Really special to be able to have an opportunity to do this, and this is runaway the best part of my day, and clearly the best part of the job today, that's for certain. I'm a pout fish with a pout face, so I spread the dreary wearies all over the place. Blub, blub, blub. You know, really reminds you what matters most, and really the true reason why Sanford Health exists, which is to care, to comfort, and to cure. This is pretty amazing.
Once we got up here, everyone that we had taking care of us was just so great from right away, honestly. They kept me calm and just let us know like what all these steps were going to be about to come. So he was born June 30th. Beginning of August, he was turning the corner and doing a lot better, and we were home for our hometown rodeo that we took my son to, and we got the call that they decided that they were going to extubate him. I remember we were walking into the rodeo literally with my son and my sister and my husband, and our nurse, she's like, the extubation went really well, and in the background I could hear him crying and I just like became a blubbery mess because that was the first time I heard him cry. And it was just so sweet. It was just like a really big victory for him. Yeah, that was a really special moment.
Okay, buddy.
Pretty early on, we knew that he was going to be a NICU baby. Just never expected it to be that quick.
My friends, says Mr. Fish.
He was 1 pound, 4.5 ounces.
I can't believe how, like, you look at him now, you just can't believe how big he is compared to when he first came, you know. It's just been a great experience here, really, considering the circumstances, you know. I'm sure like everyone else, we've had some really dark and scary days in here, but they've done a really good job of helping us through those, and obviously helping him. And, you know, they said they have a reputation for making fat babies, and he's well on his way.
Bloop, bloop. I don't really know the sounds. I don't really know Archer. So if you give me a pass on that, buddy, I'd appreciate it. But I think it's bloop, bloop, bloop.
All the nurses and everybody that day when we came in to see him were just full of love and very just kind-hearted and making sure that he was okay, but also we were okay. And they were constantly checking on us and asking us how we're doing, and they've been doing that even up until this day.
It's special to know that our teams, in addition to practicing expert clinical care, are also willing to just sit with them, just hold their hands and know what they're going through when they're juggling priorities at home, priorities at work, and they really just want to spend all their time here with their little babies.
The better part of everything is like when I can't be here, I know he's so well taken care of and loved. Like I see it on the nurses every time and our doctors, like they know him so well too, so that makes it easier for me to be home if I need to.
I should have known it all along. I thought that I was pouty, but it turns out I was wrong.
I have actually met quite a few other NICU moms who came from Sanford, and they all have the same stories, and I've met a couple fellow 22-weeker moms especially, and yeah, Sanford's awesome.
Thank you to the families that are trusting us to provide care to their children. Thank you for the families that trust us to hold their little treasures in our arms and to be able to take care of them.
That was so sweet. He had such sweet snuggles. I just love that. He was just tucked in there and he had one eye on him, watching him the whole time.
Tell you what, Liam, this is a lot better than the rest of my day.